Right now, somewhere in your body, your blood sugar is either working for you or working against you. And most people have no idea which one it is until a routine blood test comes back with a number that changes everything. The scary part isn't diabetes itself. It's the 10 to 15 years before diagnosis, where blood sugar quietly runs high, damaging blood vessels, nerves, and organs, while every symptom gets blamed on stress, aging, or a bad night's sleep. I am Dr. James Parker, and in 15 years of practice, I have watched patients hand me lab results that stun them because on paper they felt completely fine, tired sometimes, a little foggy, hungrier than they used to be, but nothing that screamed disease. Then we look at the numbers, and the story the body was quietly telling gets impossible to ignore. Here is the good news, and it's the reason I made this video. Food is one of the fastest, most powerful tools you have to bring blood sugar down, and it works far quicker than most people realize. Today, I'm walking you through 10 foods that have a real, measurable effect on blood sugar. Some work by slowing digestion. Some work by making your own insulin more effective. One of them can lower a blood sugar spike by roughly 20% in a single sitting. Stay with me through the whole list, because the foods at the end of this countdown are the ones that create lasting change, not just a quick fix. Before we get into it, if you watched my last video on the 4 foods you should never reheat because of the cancer risk hiding in leftovers, you already know how I like to do this. Real mechanisms, real reasoning, no fear for the sake of fear. This video works the same way. Let's start with number 1. Number 1 is fenugreek seeds. These are small, slightly bitter seeds used for centuries in South Asian and Middle Eastern cooking, and they happen to contain one of the most powerful natural fibers for blood sugar control that exists in the plant kingdom. It's called galactomannan, a soluble fiber that turns into a thick gel once it hits your stomach. That gel physically slows down how quickly the carbohydrates you just ate can be broken down and absorbed into your bloodstream. Instead of a fast flood of glucose hitting your system all at once, you get a slower, steadier release, which means less strain on your pancreas and a gentler rise in blood sugar overall. On top of that fiber effect, fenugreek appears to help your body's own insulin work more efficiently, meaning the insulin you already produce does a better job moving glucose out of your blood and into your cells where it belongs. The combined effect shows up in 2 places that matter most. Your fasting blood sugar, the number you'd see first thing in the morning before you've eaten anything, tends to improve. And your post-meal blood sugar, the spike that happens right after you eat, tends to blunt significantly. A simple way to use this is soaking a spoonful of fenugreek seeds in water overnight and drinking that water along with the softened seeds first thing in the morning, or adding ground fenugreek into soups, stews, and curries where the flavor blends in easily. Number 2 is Ceylon cinnamon. And I want to be specific here because this is not the cinnamon sitting in most spice racks. The cheap cinnamon found in most grocery stores is a variety called cassia, and while it has some benefit, it also contains a compound called coumarin that isn't ideal in large amounts. Ceylon cinnamon, sometimes labeled true cinnamon, is a different variety entirely, and it's the one with the strongest evidence behind it for blood sugar. Ceylon cinnamon works in a few different ways at once. It appears to improve insulin sensitivity, which means your cells become better listeners when insulin knocks on the door trying to let glucose in. It also seems to help insulin receptors on the surface of your cells absorb glucose more efficiently once insulin gives the signal. And on top of that, cinnamon slows down how quickly your stomach empties its contents into your small intestine, which naturally slows the rate at which sugar enters your bloodstream after a meal. Put those 3 effects together, and you get a noticeably smaller spike after eating, especially after carbohydrate-heavy meals like rice, bread, or pasta. A practical way to use it is stirring half a teaspoon of Ceylon cinnamon into coffee, oatmeal, or yogurt daily, consistently, rather than using it once and expecting a dramatic overnight change. Number 3 is broccoli sprouts. And this one surprises almost everyone I explain it to, because broccoli sprouts look like an afterthought garnish, not a serious blood sugar tool. Broccoli sprouts are exceptionally rich in a compound called sulforaphane, far more concentrated than you'd get from eating mature broccoli itself. Sulforaphane has been studied specifically for its effect on the liver, and this matters more than people realize, because your liver isn't just sitting there passively. Overnight, while you sleep, your liver actually produces glucose on its own, releasing it into your bloodstream to keep your brain and body fueled through the night. In people with insulin resistance or blood sugar issues, the liver can overproduce this glucose, which is a major reason so many people wake up with a higher fasting blood sugar than they went to bed with, even without eating anything overnight. Sulforaphane appears to help dial down this excess liver glucose production, which directly targets that stubborn morning number that diet alone often doesn't seem to touch. This is precisely why broccoli sprouts stand out on this list, because most foods here work around meals, while this one works while you're asleep. A simple way to include them is adding a small handful of raw broccoli sprouts to sandwiches, salads, or blending them into a smoothie, since their flavor is mild enough to disappear into almost anything. Number 4 is avocado, and I like starting the fat conversation here because avocado shows exactly why healthy fat deserves a place at the table when you're trying to manage blood sugar. Avocado is rich in monounsaturated fat, along with a meaningful amount of fiber, and together these two components slow the digestion of any carbohydrates you eat alongside it. Think about what happens when you eat white rice or bread on its own compared to eating that same rice or bread with avocado mixed in. The fat and fiber physically slow gastric emptying and nutrient absorption, flattening what would otherwise be a sharp glucose spike into a gentler curve. Beyond that immediate meal effect, regularly including monounsaturated fats like avocado in your diet appears to improve insulin sensitivity over time, meaning the benefit compounds the more consistently you eat this way. The most useful application here is pairing, not replacing. Add avocado to a meal that already contains carbohydrates, rather than eating it in isolation, since the blood sugar benefit shows up specifically when it's slowing down the digestion of something else on your plate. Number 5 is chia seeds, tiny seeds that do something almost unique once they hit liquid. Chia seeds are extremely high in soluble fiber, and when they come into contact with water or stomach fluid, they expand and form a thick gel, similar in concept to what we talked about with fenugreek, but even more pronounced. This gel coats the lining of your stomach and slows the absorption of glucose from any food eaten around the same time, which smooths out blood sugar spikes considerably. Chia seeds also contain plant-based omega-3 fats, which contribute to reducing chronic low-grade inflammation in the body. This matters for blood sugar specifically because inflammation is one of the key drivers behind insulin resistance, the condition where your cells stop responding properly to insulin signal. By calming that inflammatory background noise, chia seeds support better insulin function in a broader, longer-term way, not just at the moment of eating. The practical result patients describe most often is steadier energy throughout the day, with fewer of those sharp sugar crashes an hour or two after a meal. A simple way to use them is soaking 2 tablespoons of chia seeds in water, milk, or yogurt for at least 15 minutes until they form a gel, then eating that mixture on its own or stirred into a smoothie. Number 6 is fatty fish, specifically salmon, mackerel, and sardines. These fish are rich sources of 2 specific omega-3 fats, EPA and DHA, and these fats have a well-documented effect on chronic inflammation throughout the body. As I mentioned with chia seeds, inflammation is one of the core mechanisms that blocks insulin signaling at the cellular level. When inflammation is high, insulin has a harder time doing its job, glucose has a harder time getting into cells, and blood sugar stays elevated in the bloodstream longer than it should. The omega-3 fats in fatty fish directly counter this by calming that inflammatory signaling, which in turn allows insulin to communicate with your cells more effectively. The result over time is genuinely improved insulin function and more stable blood sugar, not just around meals containing fish, but as part of your overall metabolic environment. This is one of the few foods on this list whose benefit isn't really about that specific meal at all. It's about the cumulative effect of eating it regularly 2 to 3 times a week and letting the anti-inflammatory benefit build in the background. Number 7 is walnuts. And they work through a very similar family of mechanisms to fatty fish and avocado, but with their own added benefits. Walnuts contain a strong combination of healthy fats, fiber, and plant-based omega-3 fat called ALA. This combination supports better blood vessel health, which matters more for blood sugar than most people assume, because healthy, flexible blood vessels allow insulin and glucose to move through your system more efficiently. Walnuts also appear to improve the body's overall insulin response, meaning insulin gets released and used more appropriately in relation to the food you've eaten. The most noticeable practical benefit is that eating a small handful of walnuts alongside a meal blunts the rise in blood sugar that would otherwise follow, similar to the pairing effect we discussed with avocado. Walnuts are particularly easy to build into a routine because they require no preparation at all. A small handful with breakfast or scattered over a salad at lunch is enough to get the benefit consistently. Number 8 is whole eggs, and this one comes with a concept that genuinely changed how I think about breakfast advice for my own patients. Eggs on their own have an extremely low direct impact on blood sugar since they contain essentially no carbohydrates. But the more interesting effect is something researchers call the second meal effect. When you eat a high-protein, low-carbohydrate breakfast like eggs, it doesn't just keep your blood sugar flat during breakfast itself, it actually improves how your body handles the carbohydrates in your next meal, hours later. Eating eggs in the morning appears to stabilize the glucose response to lunch, even though lunch is a separate meal entirely. On top of that metabolic effect, eggs are extremely satiating, meaning they keep you full for longer and reduce the cravings and snacking that often drive blood sugar spikes later in the day. The combined result is better blood sugar control across the entire day, not just in the hour after you finish eating your eggs. A practical approach here is simply making eggs, in whatever form you enjoy them, a regular part of breakfast rather than reaching for cereal, toast, or pastries that spike blood sugar immediately and offer none of that carryover benefit. Number 9 is apple cider vinegar, and out of everything on this list, this is the one with the fastest, most immediate, most noticeable effect. Apple cider vinegar works through a couple of distinct mechanisms. First, it slows gastric emptying, meaning food stays in your stomach a little longer before moving into the small intestine where sugar absorption actually happens, which naturally spreads out the glucose release from a meal. Second, and this is the part researchers find most interesting, vinegar appears to help your muscles absorb glucose from the bloodstream more efficiently, essentially giving your body an extra pathway to clear sugar out of the blood beyond insulin alone. The measurable result of this combination is striking. Taken around mealtime, apple cider vinegar has been shown to lower the post-meal blood sugar spike by roughly 20%, which is a bigger single meal effect than almost anything else on this list. The most common and practical way to use it is mixing 1 to 2 tablespoons of apple cider vinegar into a large glass of water and drinking it shortly before a carbohydrate-containing meal. I always tell patients to use a straw and rinse their mouth afterward, since the acidity can affect tooth enamel over time if it's consumed the same way repeatedly. Number 10, the final food on this list is lentils, and I saved this one for last because while apple cider vinegar gives you the fastest single meal effect, lentils are the food that changes your blood sugar picture over the long term. Lentils contain a specific type of carbohydrate called resistant starch, along with substantial fiber and plant-based protein. Resistant starch behaves differently in your digestive system than typical starch. It resists rapid breakdown and instead releases its glucose slowly over the course of several hours rather than in a quick burst. This slow, extended release means lentils don't create a sharp spike the way rice, bread, or potatoes often do, even though lentils themselves are a carbohydrate source. Beyond the single meal effect, regularly eating lentils has been associated with meaningful improvement in long-term blood sugar markers, specifically A1C, which reflects your average blood sugar over roughly the past 3 months rather than a single reading. This is a critical distinction because A1C is the number doctors actually use to diagnose and monitor diabetes, and it's far harder to move than a single day's blood sugar reading. The practical takeaway is that lentils let you keep carbohydrates on your plate rather than eliminating them entirely, while still working steadily toward a healthier long-term blood sugar average. A simple way to include them is swapping a portion of rice or pasta for cooked lentils a few times a week, or adding them into soups and stews where they blend in naturally. Now, stepping back, notice the pattern across all 10 of these foods. Some, like fenugreek, chia seeds, and lentils, work by physically slowing down digestion so glucose enters your bloodstream gradually instead of all at once. Some, like Ceylon cinnamon and avocado, work by making your own insulin more effective at its job. Some, like fatty fish and walnuts, work by calming the chronic inflammation that quietly interferes with insulin signaling in the background. Broccoli sprouts stand out because they work specifically on your liver overnight, targeting that stubborn morning fasting number directly. Eggs work by shaping how your body handles the very next meal hours later. And apple cider vinegar gives you the fastest, most immediate single meal impact of anything on this list. None of these foods require you to overhaul your entire diet overnight. The patients I've seen get the best results are the ones who pick 2 or 3 of these, the ones that fit most naturally into meals they already eat, and build them in consistently, rather than trying to add all 10 at once and abandoning the whole effort within a week. Consistency here matters far more than intensity. If this list gave you a few ideas you can actually use starting today, take a second and tap that like button. It genuinely helps this information reach more people trying to get ahead of a blood sugar problem before it becomes a diagnosis. And tell me in the comments, which of these 10 foods do you already eat regularly and which ones are brand new to you? I read every comment and it shapes exactly what I cover in the next video. Before you go, if today's video changed how you think about your plate, my last video will change how you think about your leftovers. It's called Never Reheat These 4 Foods, The Cancer Risk Explained, and it covers 4 incredibly common foods sitting in refrigerators everywhere that change at a chemical level the moment you reheat them, including one you almost certainly ate this week without a second thought. If you've ever microwaved yesterday's dinner without thinking twice, that video is going to change how you handle your fridge for good. I'll leave it right here for you. I'm Dr. James Parker. Eat with intention, and I'll see you in the next one.